So we're following up on the CDC FDA recommended pause of the Johnson & Johnson COVID-19 vaccine. Do you know approximately how many doses Bellin administered of this particular vaccine?
I believe we probably administered right around 4,600 doses, and I think statewide, I think there were about 160,000 doses administered.
And so what percentage approximately of the total doses that Bellin has administered would that comprise?
Oh, that's quite low compared to our total. So I haven't done the calculation, but I would guess that's probably well less than 3% of what we've given to this point.
Okay. And since the news broke yesterday morning on this, have you seen any significant level of cancellations of vaccine appointments overall outside of the norm?
No, we really haven't. We've still been quite busy at the community site at Lambeau. So it's good to see folks are still coming in for their vaccinations. And my hope is that the public really sees this as a good thing, that the CDC and the FDA are really keeping a close eye and monitoring this closely and being very cautious, I think, in their recommendation to take a pause with the Johnson & Johnson vaccine. So I think that's what we're seeing.
Okay. And the CDC director said today that these events are extremely rare, but also she's not sure that they've seen all possible cases because they can be difficult to detect. Has there been any communication to Bellin, primary care doctors, urgent care, hospital staff, as far as what to be on the lookout for about any potential of someone presenting with this?
Yes, absolutely. Yesterday, we sent communication to all of our physicians and our advanced practice clinicians, really letting them know what to watch for, and obviously to be watching for if any of these individuals presenting with particular symptoms also received the Johnson & Johnson vaccine. So that went out. And then we also did outreach to those that would have received the vaccine, letting them know this was a very rare side effect, but here are the things to watch for. So we did, out of extreme caution, send all of that information out. I think information is important for folks to have.
And as far as Bellin, were the Johnson & Johnson vaccines used with any particular group of people, as far as, what I'm saying?
Yeah, I know what you mean, but no, we really kind of opened it up to anyone who was eligible for that vaccine. So it really wasn't used in as much of a targeted population standpoint as maybe it would be in some settings. So we definitely used it in different settings with different populations.
And Kelly McBride Moore told us yesterday that you didn't have any Johnson & Johnson clinics set up, at least for the next week, I think. So this is not affecting the number of appointments that you have available, at least right now. Is that correct? And for how far out?
Yeah, correct. It hasn't impacted us actually at all this week. Generally, we were going to be administering Pfizer vaccine this week because that's what we had on supply. And the national supply of Johnson & Johnson, actually, we knew for the next probably 3 weeks or so was going to be pretty much non-existent. So we were planning on primarily having Pfizer and Moderna for the rest of April. So not a whole lot of impact from that standpoint.
Okay. I asked another person in the health industry yesterday, whether or not he saw the pause as significant, and he did, and said that he hopes that it doesn't discourage people from going to get vaccinated. Do you share that opinion?
Yeah, I think our initial reaction was, I really hope this doesn't make folks more hesitant. However, I think it's really kind of flipping that, as I said before, and thinking about it as a good thing. So this pause demonstrates the fact that for those that were really concerned about the safety of the vaccines, that the FDA and the CDC is taking that very seriously and monitoring any adverse events, in the fact that they took such extreme action in calling for this pause. So I think if anything, I'd hope folks would look at that and say, that makes me feel a lot better about the Pfizer and Moderna vaccines, and that there haven't been these type of adverse events reported, and I feel much more comfortable getting that vaccination done.
Okay. For the first time that we're aware of, we have seen a walk-in clinic available coming up here in Northeast Wisconsin, this one in Winnebago County. How is the supply versus demand looking for Bellin right now?
Yeah, we're in a much better place. So I think we still have appointment availability this week, and we're just starting to learn about our allocation for next week. So from what we can tell, that supply is starting to catch up to demand, and that's really a great thing because, boy, it sure felt like a long road to get there. So that's really great. But I think that's also because we're getting to the point where some of the folks that were definitely going to get vaccinated have gotten vaccinated, and now we've got to really start to work and win the hearts and minds of those that have been a little bit on the fence. So I think that's part of what we're seeing too. So really getting that message out and saying, don't wait, let's get vaccinated now, especially with what we're hearing about the variants circulating nationally and in our own state.
And so would you say the wait time, if someone were to go on this afternoon and look for an appointment, when would the next one available be?
I believe they'd probably be able to get an appointment yet today or tomorrow.
Okay. Looking big picture finally here, as far as things you would not like to see happen during this pandemic, is this recommended pause in that group? And if so, where does it rank among things that you would not like to see happen?
Yeah, that's a great question. I think obviously you would never like to see a pause in a very critical tool we have to be able to stop, put an end to the pandemic. But I think ultimately when I look at it, we're probably okay with the fact that it did happen, and that again, it really gets at the safety and efficacy of the process and of the vaccines in the process that the CDC and FDA are using. I'd probably rank it maybe in the top 10, but I wouldn't put it right at the top.
Okay. All right. Ms. Baenen, anything else you would like to add?
I don't think so, but thanks for, I think, getting the word out, and information is really important for all of us to keep moving forward.
Okay. Thanks so much for the time. I really appreciate it.
You bet. You betcha. Thanks.